Hi guys, I just want to give you a little update about how I've been doing. I just got back from the doctors in Ann Arbor and I found out that I will no longer be doing chemo treatments. Yesterday I ended my radiation treatment, and we kind of moved fast with this process because I had some scans done and it came back showing that the tumor in my neck was actually deteriorating my vertebrae and was pushing on the spinal cord, so they were really nervous that I could potentially be paralyzed from the neck down. So they were really worried about sending me on my vacation to California because they didn't want something to happen when I was so far away. So they kind of prepared me with some medications that I took with me in case my arm went numb. I would take those medications instantly and then call the doctor, and then they would try to start the process of kind of stopping it or slowing it from kind of swelling and pushing on the spinal cord. I came back with no incidents happening. So I had 15 treatments done to my neck. It was Monday through Friday. It's about 5 minutes. I laid on a table and there was a mask that held my head in place to make sure that I wasn't moving around, so it would treat just that one area. As you can see, it's burnt my neck on the outside as well on the inside. That's why my voice is kind of shaky. I also have a burn on the back side of my neck on this side from the angle that they got that way, which kind of went into my hairline. So I lost a little bit of hair there, but other than that, it went very good as it could be. But this time it took a lot out of me because I was also doing chemotherapy at the same time. So I've never done chemotherapy and radiation together. And about a week ago, I stopped taking my chemotherapy drug because I kind of had an incident where I was sweating like profusely and I was kind of out of it, and I was really whiter than I am now. I was like a ghost, and I hadn't been able to eat or drink because it hurts to swallow. It feels like a knife is being twisted in my throat every time I swallow, even just like my saliva. So when I was taking my chemotherapy drug, it was staying in my system longer because it wasn't flushing out. So I kind of had a little overdose on my chemotherapy drug. So I stopped taking that, and so I stopped taking that a week ago, and I ended radiation yesterday. So I'm not on any treatment right now, and I won't be on any treatment until I start my new drug, and that is going to be a protein inhibitor. This inhibitor will stop the growth of the tumors from growing even more or spreading. It can also help the decrease the size of the tumors that have been treated. So I'm really looking forward to that. It's going to be more time in Ann Arbor. I'll be there every 3 weeks. So I'll go for a blood draw, I'll see the doctor, a follow-up, and then I will go for a 30-minute infusion in the cancer center, and then every 6 weeks I'll have a scan. So right now I'm getting scans every 3 months, so I'm getting scans about twice as often. And with that, before I can start, I have to have a biopsy of my right lung. So I have a few nodules in my right lung, so they'll aspirate one of the tumors. I won't be put out for this. They'll just stick a needle in, take what they need. And then I will also have some lung functions done because this protein inhibitor doesn't have side effects like chemotherapy, but it can affect your immune system and kind of have your body act as it's trying to fight a disease possibly. So they're really going to be monitoring my liver and my lungs to make sure that they're not swelling up and I'm losing functions of either of those. And after 8 weeks of starting the process, I'll have a second biopsy of my right lung. And I'm not really sure why they're doing the biopsies, but I'm assuming it's so they can see how it changes the structure of the cells. And like I said, I'll be in Ann Arbor more often than I have been now, but I won't have the side effects of like the sores all over my body and the lightening of the skin and the nausea, loss of appetite. Like I said, I haven't been able to eat or drink, so I've been having to take Ensure drinks to make sure that I stay not hydrated, but so I can get some nutrition in my body. Because from last Friday's weigh-in to today, I have lost 10 pounds, which is not good. And they've been trying to get me to take some pain medication, but I really don't like to take pain medication. So today they offered me morphine, and I declined on that because it's not really like a pain that is intolerable. and I don't really feel like I need a substance to help me get through this, because I've been going to work. I only missed half of a day from work in this whole year. So like I said, I'm not going to take anything for pain, because it's just a temporary thing. I can get over this pain, and I'm just really excited to start this new protein inhibitor. So if everything works good, I could be doing this for the rest of my life. As long as the tumors stay the way they are or shrink, I will just keep doing this every 3 weeks, and the process will continue. This drug trial is different from the other drug trials I've been on, because the other ones were blind studies, so I didn't know if I was actually getting the drug or the placebo. And this time everybody receives the drug. That's why they're doing so much testing, so they can monitor how it's affecting everybody's body. And every 3 weeks is not bad. I'll take that over feeling tired and nauseous, and I just really want to eat again, because I really love food. And I just wanted to say thank you for you guys, for all the positive support and love and prayers. And I'll keep you updated. If anything changes, you guys will be the first to know, because I'll post another video. Thank you.